My name is Mariana Matus. I'm co-founder and CEO of Biobot Analytics. We are an MIT spin-off and a wastewater epidemiology company based in the Boston area. It's a pleasure to be here today addressing this amazing community of Latinas in tech. Thank you again for the invitation. And I'm here to share more about my story and what we are doing at Biobot to hopefully motivate many more Latinas to go into startups, and particularly to consider startups that are having a massive impact in the world, in our health, in our environment. To begin with, let me tell you a little bit more about my journey. I am originally from Mexico City. I grew up loving science, loving nature, but unfortunately witnessing all around me the damaging effects of overpopulation, of pollution in our environment. Mexico City is one of the largest cities in the entire world, and I witnessed firsthand rivers and lakes being lost to that urban pollution, and that made a big impact in me. It really motivated me to think about how can I use my skills and my love for science to impact the world. That was a tough question. I didn't know how to go about that. In fact, growing up, I also thought that science was something that had happened already in the past, rather than a profession that I could choose to exercise today. And it was pure luck that brought me to a new program at UNAM, the National Autonomous University of Mexico, to study genomics, a new field at the intersection of molecular biology, computer science, statistics, in order to understand all of that new genomic data coming out of at the forefront of research, and with a promise to completely change how we think about human health and how we treat human disease. It was then that I realized that science was actually a very present profession that one can pursue, and where I fully fell in love with the potential of the potential of genomics to change the world. However, that was not the end of my journey. That career in science took me through grad school, first a master's program in the Netherlands, and then a PhD program at MIT. And I was then, I came across yet another possibility for how to do how to use my skills and impact the world other than pure scientific endeavors. I came across the movement of entrepreneurship and this idea that anybody can be a founder, and it doesn't matter if you are an engineer or a scientist and you didn't study business during school, you can still go on to become a founder, tackling a big problem that you really care about. And here's where I truly, all of the previous dots connected into one story for me. I realized that what I wanted to do was to create companies that leverage the latest science, the cutting edge science, to impact the world. And that's what Biobot means to me, is the opportunity to make a big difference while using science. Science, there's just so much opportunity in bringing science out of the lab, out of universities, and into real applications, to solve real problems for the world. At MIT, besides finding the movement of entrepreneurship, I also met my co-founder, Nusha Gailey. She is an architect and an engineer. We were very lucky to meet each other through a scientific collaboration between our labs. And soon after, we realized that we were both passionate about pursuing entrepreneurship, about becoming founders, but also about the potential of that research that we had been developing over the past several years. And that's where BioBot was born. Sometime in late 2017, we founded BioBot with the objective to transform wastewater infrastructure into a public health observatory. Basically, we look at wastewater not as waste, but as a data asset that contains very valuable health information about us, about everybody who is using the bathroom every day. And every time we use the bathroom, every time we use the toilet, we are sending away valuable information about us, about the infectious diseases that are circulating, about substances and pharmaceutical products that we are consuming, about diet, wellness, stress, and so on and so forth. Our vision is that one day this type of data will be collected everywhere, in every city, every town, and eventually every community that cares about the health of a population, including colleges, nursing homes, prison systems, to understand how to stay ahead of new threats and intervene in a timely manner. This vision, when we founded BioBot back in 2017, this emerging field of wastewater epidemiology was still extremely niche and obscure. Even within academia, I could count with the fingers in my hand how many labs were doing this type of work back at that time. But then everything changed with the COVID pandemic. Wastewater epidemiology has now grown to be acknowledged, to be recognized as a valuable source of information, as a new metric. And it's been amazing to have a front seat during that transformation. Basically, from the very early days of the pandemic, when BioBot stepped in to fund research and to demonstrate that you could detect the genetic material of the virus, the RNA of the virus in the wastewater samples, in order to map how much COVID there is in a particular city or town, and being the first ones in the country to publish, to report this finding, and then going through all of that period of just like doubt from more established experts, wondering if this data was actually accurate or not. I mean, if you think about it, the data source is noisy. It's not just toilet flushes that are feeding data into the wastewater infrastructure. It's also all of the other water that we consume at home and in industries. From every time we wash our hands, take a shower, or run the laundry, all of that water is making its way into the wastewater infrastructure as well. So definitely it was not an easy or like for granted type of exercise to demonstrate that this data is accurate and you can trust it. And the amazing thing that has happened over the past 2 years is that now this data not only has been recognized as being credible and an accurate measure of what's happening in our communities, now more recently, it's being recognized actually as the new gold standard. As you may all well know, mass clinical testing is decreasing. Most people, or many people, are now turning to use the rapid antigen tests that you can apply yourself at home as a new way to manage your own risk and as a new way to go on your activities like traveling and meeting other people. So what that means is that the clinical PCR data that we have all been relying on, and that particularly government and businesses have been relying on, is no longer accurate. And the more we continue to make progress through the pandemic, the less data we will be getting from PCR and the largest the data gaps. This is where wastewater data steps in and can make a big difference, because the wastewater and this book data is not biased by our own behavior. It doesn't matter if we are getting a PCR test or an antigen test or no test. We are still contributing to the wastewater, and therefore it really has become the most trusted source of truth in this later version or stage of the pandemic. And this will continue to be the case as we evolve into the new normal, as we continue to make steps towards the new normal. Wastewater epidemiology and the data coming from the wastewater is one of the main pieces of the toolkit that all of our community leaders are getting behind. And it's been amazing to see even bipartisan support for the technology, which not always happens when there's a new intervention. But I think everybody across the board is recognizing the opportunity here and the potential not only to continue to use wastewater as a post-pandemic tool, but also as basic infrastructure to prevent the next pandemic. This is a type of platform that can be run in the background for a very small cost, a fraction of the cost of what mass testing conveys. And besides COVID, you can look at other things. We have already validated the use of wastewater to track influenza, seasonal influenza that, as you know, has a big effect on the productivity and the health of the country every winter. We have already validated that you can use the wastewater to track substances that drive overdoses in communities, including fentanyl, meth. We have already demonstrated that wastewater can be used as well to track wellness, including stress levels of the population. So there's a very big opportunity here to leverage that same platform, that same infrastructure, to look at other things. And we're not the only ones that now are seeing the opportunity. The CDC now has a national wastewater epidemiology team with a dashboard and data collection efforts, as well as a roadmap for post-COVID. There's also a contract that we executed not just for local governments, which we have been working now across almost every state in the US, as well as Canada. But now we have also had a contract with the US Health, HHS, the Department of Health and Human Services, in collaboration with the CDC, in order to provide nationwide data to them. And incredibly successful program. It allowed us to test 100 million people in the US last summer with only about 350 samples. And that really, I think that really demonstrates the scale of what can be accomplished here and how much more affordable it is to be testing 1/3 of the American population with only about 350 samples. And that's amazing. Going forward, these data will also be used to track variants, the emerging variants of concern. As you know, those variants have been largely responsible for the uptick in cases, regardless of having now the vaccines available in populations. So it's really important to keep an eye on variants as they emerge and spread. And last summer, through that federal contract, BioBot was able to track the rise, the emergence and rise of Delta, the Delta variant, as it became dominant and replaced Alpha. And soon after, the big uptick in disease activity that we also saw in the wastewater. This January, we were also able to see that massive Omicron peak that affected the US and that drove the levels of COVID in the wastewater to the highest historical level we had ever seen in the entirety of the pandemic. So really demonstrating that the power of this information to tell us what's coming. It's worth noting that for the Omicron peak, the wastewater data showed the peak about 2 weeks before we saw the peak in the clinic. And that's because, why? Again, going back to just the reduction in PCR testing that we are seeing, just takes longer to observe the population before the data really indicates the peak. So who is using the data? It depends, but this data is now public. All the data that we collect is published in our website, and there are many, many others that are also making their data available, and that is great, because that means that this data and this intelligence isn't just for community leaders, right? It's of course for them so that they can make policy decisions and they can understand what's happening, situational awareness. It's for public health agencies as well, like from local departments all the way to the CDC. But this data is also for outside government. There are many businesses that are looking at our website and our data in order to make decisions about their own operations. For example, the Boston Children's Hospital here in our city, they look at the wastewater data in order to understand if they can schedule non-elective surgeries in their population or not. Basically, if the levels are low, then they don't expect their ER to be inundated, and therefore they proceed to book the non-elective surgeries or just surgeries that they have in the backlog. And that's an example of the power of the data. It's relevant for everybody. We are all contributing to it, and we all can benefit from it. On a more personal note, I myself, I am mom to a 16-month-old toddler. She doesn't have a vaccine yet. That age group doesn't have vaccines available yet. So it's very important for me and my family to be very safe in how we choose to socialize and go out and travel and so on. So we absolutely leverage the wastewater data from our city in order to inform how much risk we are willing to take with a little one. And that's the power of the data again. We're all contributing to it. We can all benefit from it and manage a little part of our world with it too. So with that, I'd like to conclude my presentation, and I am looking forward to the questions, and thank you again for the opportunity to be here today.